to Dr. TJ An Show. I'm here with Dr. Wadera. So, again, welcome to my show.
Thank you for having me.
Yeah, well, actually, it's the show, but I'm checking out your place too. So this is also very awesome for me. So for our viewers, could you introduce yourself and to my audience and viewers?
Yeah, I'm Dr. Ashim Wadera, podiatrist. Did my medical school training in Chicago. I came back to the Detroit area, which is where I practiced. Did my residency here. Then I did a fellowship in Indianapolis to further my training. I didn't practice with orthopedic group for several years. Did all aspects of foot and ankle surgery, from bunions to total ankle replacement surgery, ankle fractures, Charcot reconstruction, everything you name it. And my last year there, I started to start getting introduced to minimally invasive surgery. And then I really started to love the technique, and I decided it was time to leave the group and start my own venture.
Nice. So how long have you been out with your own practice?
It's just shy of a year. Actually, next month, September, well, we're in September already, but in a couple of weeks, it'll be 1 year since we started this new venture.
So let's go back to even before you became a podiatrist. So what made you want to become a podiatrist? Just give us some of your story, how you, your upbringing, etc.
I actually thought, I didn't know I would become a foot and ankle surgeon. I actually thought I'd be a veterinarian. My dad's a veterinarian, and he's been in practice for about 35, 36 years, very booming practice. And I thought myself and my brother's also a podiatrist. We thought we'd take over my dad's office, my dad's practice. But as I started to get a little older, high school, I came to realize that I can't see animals hurt or sick. Makes me sad.
Okay.
We grew up with animals, and I just love animals so much. And it takes a very special person to do that.
Is that dog or a cat?
Both, actually, both. Even reptiles, actually, growing up with reptiles. I love animals. Anyways, as I got a little bit older, I started to shadow different specialties within healthcare. And it wasn't until I got to college where I shadowed podiatry for the first time. And when I shadowed a podiatrist out of the local hospital here, first of all, I thought podiatrists only did some, pedicures. I didn't know anything about podiatry. I really thought it was just glorified pedicures, I'll be honest with you. But then I saw what these guys were doing. I mean, it was full-on surgery, and then I saw how happy the patients were afterwards. And so I thought to myself, there's a lot of really great things with podiatry, from surgery to non-surgical methods. Everybody needs their feet. I even suffered from plantar fasciitis in college, painful condition. I knew nothing about it back then. I just sort of treated myself. But the point is, I really, once I started shadowing and saw what podiatrists could do, I was pretty much all in at that point. I said, you know what, this is what I'm going to do. And I got into school, Chicago School, Scholl College of Podiatric Medicine. My cousin left the business world he was in, saw what I was doing, followed my footsteps, and then my brother followed my footsteps. No pun intended.
I've been working with you for past 2.5 years. You took me as your mentor, and I'm honored. And you're one of, again, very few mentees I've worked with who literally took action without hesitation, fully committed. And I'm just, shocked, astounded, like how driven you are. So my question to you, again, this part maybe another podiatrist might be watching. So what motivated you when I helped you and you got into our programs? What motivates you so much? Is that your personality, or is there any motivational factor?
Yeah, that's a good question. I was, before I started working with you and the group, I was on the verge of burnout, to be honest. And the orthopedic group I had was my first job out of my training. And very fast, I was already heading towards burnout. I didn't even know what burnout meant. You hear it from people, 30 years into the career, I'm done, I'm burnt out. But I truly started to feel it. I was seeing how my patients, even after big surgery, everything went great in surgery. And then, just dealing with day-to-day hospital stuff, being delayed in the hospitals, surgery centers, I have a wife at home too, and I just was not coming home on time, and it was just becoming too much. Volume-based practice too, where I was seeing so many patients and wanted me to see more and more and more, seeing a lot of denials and insurances. And in the real world, well, let's take it back. In training, they don't teach you that stuff. In training, it's
So business side of it.
no business in training. I think a lot of young docs can agree with that you get no business at all mindset. In residency, it was all about surgery, do the biggest surgery possible, and learn all these cool surgeries. And I got the orthopedic group job, and that's a podiatrist, quote unquote, dream job. Foot and ankle surgeon for orthopedic group. Thought I landed the dream job.
So how many patients did you see daily there?
Probably sure, easy 40, maybe 50 a day.
Wow. Yeah. And then that will basically result you in a burnout.
Absolutely. And so coming back to what I was saying was the patients were miserable after surgeries, and I thought to myself, well, I started thinking, well, why are these patients so mad and, depressed after surgery? Well, nobody likes to be out their foot for 3 months at a time, 8 to 10 weeks. Nobody likes big incisions. It creates a lot of swelling and possible postoperative infection, possible DVTs, as we all know. But I started to see it myself. And I talked to some of my mentors from my fellowship and residency, and I asked them, is this how it is in the real world? I was a resident of yours, a fellow of yours, but truly, again, this is how it is. This is how it is, and I said to myself, this is not why I got into this career. I truly came to this career to help people. That's when I started to learn about minimally invasive surgery, and I started to see things differently. I started to do, the two-screw technique, with that, I started to see a big difference right away. I said, this is great, Lapidus bunionectomy versus this technique. I'm already seeing patients so happy already, walking the same day. They had called me a magician, and I was like, this feels pretty good. Nice. Then I found your YouTube videos, and I saw, hey, you know what? I met Dr. Ahn, and I hear Dr. Ahn's doing surgery in the office, and I was like, wait a minute. I didn't even know that's possible under local. That's great. And that really perked my interest. And I started hearing about the real MIS without fixation and such. And once I learned about that, I joined the group, and I was just like, this is it. I'm all in. That makes perfect sense to me.
So to recap, your burnout was caused, this whole motivating factor, majority of it is burnout.
Absolutely.
Is that right?
Yeah.
And that you just kind of focus like all in, right? That's what happened to me too. So I was just wondering if it is similar.
Yeah, even before I decided to move and start my own practice, I never in my wildest dreams thought I would be a business owner. Like, I was even deterred by my mentors. This day and age, you can't start a practice. EHR is really a big headache. Insurance companies a headache. So you're better off working for a big institution, just take home a nice salary and just follow the rules. I was, weighing that back and forth, and I thought, let me just leave this ortho group. Maybe I can start I'll just join another group somewhere else. And so kept thinking about it, and we almost moved out of the state to Florida. I have family in Florida. I started interviewing with some groups, and my wife actually just asked me one day, us moving, is that gonna help all your problems? I thought about it. I said, if I go to another group, it's going to be volume-based again. It's going to be all the insurances again. Maybe there'll be a honeymoon period, new location, 6 months. This is great. I really thought about it. I really had to think deep about this. And I told myself, you know what? I have to just create my own opportunity now. I know what I want out of my life. I know what I want out of my career. It's not anywhere else. I need to create it. And that's what motivated me to start this practice.
So beyond MIS, what other specialties? Because I'm a true believer in subspecialize in podiatry in order for us to sustain and, as you know, and thrive. So what other specialties are you focusing beyond MIS?
Great question. I really also specialize in something known as regenerative medicine, harnessing the body's own potential to heal itself, utilizing certain modalities like laser therapy, shockwave therapy, also known as EPAD, even using injections such as amniotic fluid. The phenomenal thing about these is that we're truly treating the root cause of the problem without the big side effects that can come with traditional medications. Traditionally with laser and shockwave therapy, there's no need for injections. Patients don't typically have pain with this stuff afterwards. They're able to walk the same day to help reduce pain, reduce the swelling, and allow them truly to get back to their life. And so I have that aspect of my practice as well that has really helped a lot of people. Even though I'm a surgeon, I'm a big believer in non-surgical modalities. And in my mind, if we can fix something without a surgery, that's a win.
So you always like to recommend more non-surgical, non-invasive to minimally invasive.
Absolutely. And in my book, and again, even as myself, if I take the doctor hat off for just a second, if I'm a patient and I see a doctor or a specialist, I would want something non-surgical for myself, something along these lines, before jumping to more, invasive type procedures. And I think that most people would want that for themselves. The thing is, most patients will understand that these things exist because they're so used to going to a insurance-based clinic and only given treatments that insurances allow. But we have so many great modalities here that can truly help patients without a lot of side effects that truly correct the root cause of the problem.
Let's talk about that part. So it's a great point that I want to discuss with you, that, a lot of surgeons or a lot of podiatrists and also other specialists know there are so many great treatment solutions exist. But I know the main reason why they don't like to implement those treatment solutions and modalities for their patients is because of that insurance situation. So I know you adapted that model that I'm preaching and big advocate of, which is hybrid concierge model, and you totally adapted in your practice. So tell me more about, why you felt that was necessary for you, and, explain to our viewers what is hybrid concierge model to you and to your patients, and then maybe we can go from there.
Simple. Hybrid concierge model is still taking some insurances, but I don't let the insurance company dictate how I treat my patient. Insurances only allow certain things to be covered. And I'm not saying that those things are bad for patients. There's a place for them, but there's other modalities, and most of the time better modalities, that I can offer my patient that the insurance company just doesn't want to cover. But those modalities truly help patients from the root cause of the problem versus more of a Band-Aid approach, such as a steroid injection. And all too often I hear about it from my patients. They've seen 3 or 4 doctors, have all had the same treatment, and then they come to me, and then they're just, well, no other doctor explained this to me. Why is that? Well, it's not covered by insurance. However, this is a better treatment solution for you. And I believe in this treatment solution because I've helped a lot of people with the same condition you've had, and every single one of them have done significantly better than what they've had in the past.
Nice. So another reason why most doctors are afraid of this is that, which is not, again, their fault, because they're not trained, like you mentioned earlier, in a business aspect. So again, what were the challenges for you when you started introducing hybrid concierge model, adapted to it, and build your practice, based on that? Were there any challenges?
Yeah, I mean, I can't sit here and say there were no challenges. The biggest challenge most people are going to face, and most doctors are going to ask you as well, if they have insurance, why are they coming to you? Why are they wanting to use something that's outside this insurance? Again, coming back to what is the best treatment solution for the patient? It's not about, okay, well, I know this is the best, but unfortunately, this Blue Cross plan doesn't cover it, so I have to only do a steroid injection. Or, maybe this patient would benefit from custom orthopedic insoles, but this insurance plan is not going to cover, so I'm not going to give it to my patient. You have to stop thinking like that. And if you show the patient exactly what they want to hear, in the sense that they're going to be out of pain, help the root cause, allow them to walk, and be out of pain so that they can still work, provide for their families, they're going to take you up on the offer every time.
Yeah. And what are you seeing from your patients' experience, patient's point of view? Share with us, help us understand, what have you seen, from patient's perspective that are different from traditional volume-based practice?
It's hilarious you asked me this question, but the serious. I can't tell you how many times patients have said after treatment, I wish I found this office sooner because I wasted so much time or I've been in so much agony. Patients are blown away that we are able to fix them sometimes without an incision, but even when it comes to the incision that we do, keyhole incision, small spot, small incision to correct the big bunion or the painful hammer toes, or even heel pain where most often we can heal without the need for procedure. But when it comes to a procedure, they're amazed with how did Dr. Wadera, through a 3 millimeter or 1/8 of incision, how did he help me? It's amazing. And I can't tell you how many times these people say, you're a magician. I'm not a magician. I've just learned a technique that I love, that I believe in. I have good mentors that have taught me this technique, and I believe in it because this is exactly what I want for myself. So this is what I'm going to offer to my patient.
So this question is for potential patients who might be looking for this type of solutions, but they don't know where to go. They don't know what you provide. So what type of medical conditions are you specializing in? Again, we're foot and ankle specialists, but I'm talking within foot and ankle. What are you truly focusing on and, being the expert on those areas? So tell us some, foot and ankle conditions you like to focus on.
I see bunions. That's probably a better bread and butter. Bunions, hammer toe conditions, heel pain conditions, any sort of tendon injuries, ligament injuries, certain fractures as well. Now, again, I'm no longer doing big open surgery for fractures. What I try to do is heal the patient without needing surgery. So, for example, if a patient has a torn ligament, traditionally they'll go to a doctor's office and they'll likely book them for a surgery. But we have modalities in this office that may not require surgery, such as amniotic fluid, laser therapy, even with the heel pain, same scenario, utilizing the modalities we have through regenerative medicine techniques to help. So just to sort of answer that question again, bunions, hammer toes, arthritic conditions, bumps on the foot that may be causing pain, tendon problems such as Achilles tendonitis, very common. Again, plantar fasciitis, also known as heel pain. We try to help everybody. Honestly, at the end of the day, we will never say no to anyone. If you're going to come to our office, you're going to see it's different. It's not pushing you to do surgery right away. It's not pushing you to take a bunch of drugs and medications that might create side effects. We truly utilize the power of regenerative medicine and take a holistic approach to helping our patients because, again, that's exactly what I would want, and that's what I want to provide for my family and my patient.
What do you see yourself in next 2 to 3 years?
Because I have, I have a family that's also in podiatry, and they currently are in the traditional model. They see what I'm doing here. The next 2 to 3 years, we're looking to really expand this practice and bring them on too as MIS, minimally invasive surgeons and regenerative medicine specialists, so that I can help more people. My goal is I want to help as many people as possible. In the next 2 to 3 years, you'll see a big expansion, but still, utilizing these techniques that we just discussed, not straying away from the overall message here, which is we try to heal everybody without surgery if we can, and when it's time for the procedure, we'll do it through the small incision. You'll walk the same day, less swelling, less pain, and you'll be happy.
This has been an interview with Dr. Hashim Wadera, and I did put the information how to contact him or how to reach out to him if you're watching this video and you believe you might be a great candidate to become his patient. So detailed contact information for Dr. Wadera is in the description below. Again, thanks for watching this show, and don't forget to subscribe to my channel if you want to continue to see this type of videos down in the future. And Dr. Wadera, it's been an honor.
Thank you so much.
Working with you.
Yes.
And it makes me so happy and proud of you to see you in action, helping patients. I got to see you treat patients for non-surgical as well as also surgical.
Yeah.
And again, it's been such a privilege for me to help colleagues like you and then, help you build your lifestyle podiatry practice and help thousands of patients. Awesome. Great.